the next document is talks about the genocide in a fair degree of detail, and I'd like to go through that. So what's going on here is I'm going through this as who, what, how, and why, and then what's the solution. So I'd like to spend the balance of our time on this document. And I want to just frame this. So if you think through World War II, you think, well, how did this even happen? How did any of this stuff even happen? Well, the reparations from World War I were how Hitler got in power. The financial burden of the reparations had the Germans looking for an alternative solution. So if we follow the money trail in the United States, the disabled and the elderly are 39% of the federal budget. And the last Medicare trustees report, which is dated August 31st of 2021, it concluded that substantial changes need to be made. And I'm here to say substantial changes means including taking people out. Well, in the research that I've done since Grace died, I stumbled across Agenda 21 and Agenda 2030, which has an overall agenda called the Sustainability Agenda. And one of the two tenets, so of course there's climate control, which they've been pushing on us for years, but the other one is population control. And that's never been out in the public, but it's getting out in the public now, and people are getting wise to it. And I'm sharing that, in fact, it's happening. And that's why Grace was taken out. So they're taking people out. You're in the alternative media, so you know what's going on with the jab. Birth rates are being reduced because of the jab. Dr. Malone came out and said in December, if you want to have grandkids, don't let your kids get vaccinated. The death rate of the people who have been vaccinated is substantially higher than the death rate of the non-vaccinated. Kids are having strokes, cancer's going up, healthy athletes are dying. So that's just the genocide related to the jab. But what I'm explaining is the genocide, when we think about it, is normally about population groups like the disabled, the elderly. But what it is, it's way bigger than that. They're after a worldwide population reduction because the evil that Satan has laid out is, and he's got his minions believing, is that this planet can't survive with 8 billion people. So now we take it to the hospitals. And of course, I already explained the elderly and the disabled are the first to go. Well, what is the reason? How can the elderly and the disabled be the first to go? How did this even get set up? Well, in this process, I came across Hannah Arendt's research. And she's the one who researched the Adolf Eichmann trial in 1961. And she coined this phrase, the banality of evil, which means evil's so commonplace we don't even recognize it. So I want to set this up to explain relative to the disabled and the elderly, what does that look like? So you might say, Scott, what do you mean evil's so commonplace with the elderly and the disabled? Okay, so if a young person gets pregnant today, what does the doctor recommend? And the doctor always recommends that they get an amnio done. So then they get an amnio done, and the amnio shows that the baby's going to have Down syndrome or going to be disabled with some major complication. What does the doctor recommend? He recommends aborting. In the United States right now, 67% of Down syndrome children are already aborted. Worldwide, some countries are substantially higher. Some countries have eliminated Down syndrome. Denmark, for example, has eliminated 98%. They consider it that it's basically an unclean part of the population. And so now take that as that's considered normal. So in the United States, it's considered normal to abort a Down syndrome child. It's considered normal to abort a disabled child. And so now that same child gets into a hospital. So the young nursing staff, they see that person already as somebody that doesn't fit the mold that they've been indoctrinated to. That's the banality of evil. It's so commonplace, the person in society doesn't even realize it's happening. As that applies, same concept applies to the elderly. 5 decades ago when I was a kid, you took care of your parents. You didn't put them in a nursing home, but now nursing homes have become commonplace. So that person's already lived their life. They just get to end their life in a nursing home. And so that is the banality of evil relative to the elderly. So now that same elderly person gets into the hospital and the young staff sees them as expendable. So that's the banality of evil. So now another thing that happened out of the Adolf Eichmann trial is the Milgram obedience experiment. The Milgram obedience experiment took 40 different people. Remember, this is an experiment. 20 of the people were actors, 20 of the people were participants. The participants didn't know that it was an experiment. The actors, of course, did know. The 20 actors were hooked up to electrical leads. And if they answered questions incorrectly, the instructor told the participant to give the actor a jolt. Remember, the person's an actor. The person giving the jolt doesn't realize they're not really getting jolted. 2/3 of those participants gave a high enough of a jolt to kill the other person just because they were instructed to do so. So now, if you overlay the banality of you overlay the Milgram obedience experiment with the banality of evil, and what you've got is the perfect setup for taking out people like Grace and the elderly in a hospital setting.